Hi parents, I'm Dr. Shivani Deswal. I'm a child gastro and liver specialist in Gurgaon. Today I'm going to talk about poor appetite in children. What are the common causes? When should you be worried? What you can do at home to increase your child's appetite? What are the causes of poor appetite in your child? Your child could be having iron deficiency anemia, and it could present as the first sign as loss of appetite. Your child could be having oral ulcers or an oral thrush, a white deposition in your child's tongue, which can lead to poor appetite. Your child could be having worm infestations that could lead to poor appetite. Your child may be having a systemic illness like a chest congestion or a sore throat that can decrease your child's appetite. Your child could be having changing milestones. Your child is suddenly started walking and does not show interest in sitting down and eating, or your child's growth spurt has decreased because of normal physiological variation compared to the first year in life when your child is gaining very quickly weight and height, and his appetite may fall a bit. Child may have a GI illness like a reflux problem or an inflammation of the stomach or the intestine, which may affect his appetite. So when should you be worried and consult a child gastro? If your child is having a poor weight gain or his weight is static, if your child is having abdominal pain, if your child is having vomiting or a facial swelling or a rash after eating a particular food, which could point towards an allergy, if your child is having alternative bowel habits like recurrent diarrhea or constipation, or if your child is having an aversion to food and a lot of nausea, you must consult a child gastro specialist. Otherwise, normal variations of growth spurt and developmental milestones are very common in children and you should not worry too much. There are a few tips that I can give you to increase your child's appetite. Make sure that you're feeding your child at fixed meal time. For smaller children, we say 3 major meals and 3 snack times. But make sure that you're spacing them equally so that your child is hungry whenever you offer the meal to the child. Do not give your child too much of sweets, too much of milk, too much of juices, which may decrease your child's appetite. Make sure that the child is not distracted. So do keep your child away from toys and phones when you're feeding the child. Instead, the child should know that after he's eaten his meal, he will get that game back again. A family mealtime is very important. To give the choice to the child to choose his plate, his cup, and to sit together and eat at one table. Make sure that your child is given one particular food of his choice every time when you offer a meal, while the other new things you must introduce. Sometimes you have to introduce 12 to 15 times to develop a taste to a particular food. You should also be aware of some rarer causes of poor appetite in children, which we call as eating disorders. Eating disorders are common in children who have anxiety or who have developmental issues, or children in teens. They sometimes have anorexia nervosa, that is, they are very conscious of their body image and they don't want to eat food because they want to remain low on weight. The other could be bulimia, when they are inducing vomiting and taking out whatever they eat. The third could be binge eating, when they're eating too much of food and they have no control over their intake. And the fourth could be avoidant or restrictive food intake disorders in children, where stress, anxiety, attention deficit hyperactive disorder children have a particular preference to a particular food. They do not like a typical texture of food or color of food, and they start going poor in growth and weight, and not just aversion to food or not just, fussy eaters. So if your child is showing any of the warning signs, do consult a child gastro specialist. But however, if your child is growing well, gaining weight, is comfortable, then do not panic and follow these important tips to make your child a happy eater.